Now we're going to see von Willebrand disease. Von Willebrand disease is deficiency of the von Willebrand factor. This is, we have the vessel, here is the cells, and below these cells we have this endothelial collagen here. So when there is disruption of the vessel, injury to the vessel, there is exposure of the endothelial or of these two endothelial collagen, and this endothelial collagen binds to the von Willebrand factor, and also the platelet with the glycoprotein 1b will bind to the von Willebrand factor and to this endothelial collagen. So this is how the platelet thrombi formation began. That is with the addition of the platelets to the endothelial collagen through the or via the von Willebrand factor. So the von Willebrand factor have like three. Von Willebrand factor has three mainly activities. One is to binds to the subendothelial collagen. 2 binds to the glycoprotein 1b, and 3 like transports or binds to the factor 8. So patients with von Willebrand disease can also have a low factor 8, and so in the lab values we will see decrease in the factor 8 that will be revealed as a increase in the partial thromboplastin time. It could be elevated or could be normal. It depends on the severity of the disease. And certainly because the platelet cannot adhere, we will see increase in the bleeding time, but the platelet would be completely normal. The count would be normal. So the patient will present with bleeding, could be after removal of a teeth or menorrhagia or epistaxis, and usually would be worse after aspirin. Sometimes the disease could be asymptomatic, and when the patient takes aspirin, would notice the extreme bleeding. So the patient will present with bleeding, then we certainly need to ask for complete blood cell count and the partial thromboplastin time and the prothrombin time. The bleeding time would be the first next step, and the most accurate test is do a ristocetin test. This is, we would put the serum of the patient and we would mix it with ristocetin. That is, in a normal patient, if we put the plasma of the patient and the ristocetin, this ristocetin makes that or promotes that the glycoprotein 1b and the von Willebrand factor join, and so is platelet adhesion and then platelet aggregation, but it's platelet addition. So you can say that the ristocetin is like mimic the activity of the subendothelial collagen. But in patients with von Willebrand disease, there would be no addition of the platelets because the von Willebrand factor cannot bind to the glycoprotein 1b. So the ristocetin test will be positive, that is abnormal, when there is no addition of platelets. The patient needs to avoid aspirin or other NSAIDs, and also inhibitors of the platelets like clopidogrel, for example. And if the bleeding is very mild, we just give desmopressin. Desmopressin will induce the release of von Willebrand factor or the storage of von Willebrand factor from the endothelium. So for that we give desmopressin or desmopressin acetate. If it is more severe, we give von Willebrand factor, and we could also give factor 7. The bleeding is severe and we need to stop the bleeding, but because there is von Willebrand factor deficiency, then we also have decrease in the in the factor 8, that is the intrinsic pathway of the coagulation cascade. So the other way to stop the bleeding is if we activate the extrinsic coagulation cascade, that would be with factor 7. And here the fresh frozen plasma doesn't work, so we only give desmopressin for mild disease, and for severe disease von Willebrand factor and factor 7. There are three main diseases of von Willebrand disease. That is, the type 1 is when there is just deficiency of the von Willebrand factor, that is just decreased von Willebrand factor. The second is a qualitative deficiency of the von Willebrand factor, and the 3 is absent of the von Willebrand factor activity. The first and second type are autosomal dominant, and the other is autosomal recessive, but the most common is the autosomal dominant disease. So the patient will have a family history, and could be either in women and men, because this is a autosomal dominant disease, that is in a autosomic chromosome, that is not a sex chromosome. And the other thing is that it's very common disease, because like 1% of the population in United States have von Willebrand disease.